How does the body recover after a tonic-clonic seizure? Imagine witnessing someone suddenly convulse and then slowly regain awareness. After a tonic-clonic seizure, the body goes through a recovery process called the postictal phase. This period can last from a few minutes up to half an hour or longer, depending on the person. During this time, the person may feel confused, very tired, or drowsy. They might also have a headache, muscle soreness, or pain from injuries like tongue biting or bruises from falls. As the brain and body recover from the intense electrical activity that caused the seizure, consciousness gradually returns. The person often feels disoriented and exhausted, which is normal as their brain resets itself. The first thing that happens is the person begins to regain awareness. Usually, they are unconscious or semi-conscious right after the seizure stops. Over the next few minutes, they start to become more alert, but confusion and difficulty speaking are common. This confusion is part of the brain's process of returning to normal function. Once consciousness starts to return, muscle stiffness and jerking movements stop, but soreness or weakness can linger because of the strong muscle contractions during the seizure. Injuries like biting the tongue or cheek can cause pain or bleeding, which can be managed by rinsing the mouth with salt water once they are more alert. Any bruises or injuries from falling should be checked and cared for as needed. Breathing may have been irregular or slowed during the seizure, sometimes causing a bluish tint around the lips due to reduced oxygen. Usually, breathing normalizes after the seizure ends. Supporting the person by placing them in the recovery position, lying on their side with the head slightly tilted, helps keep the airway clear. This position prevents choking on saliva or vomit and makes breathing easier during this vulnerable time. The brain's electrical activity gradually stabilizes, which explains why symptoms like confusion, tiredness, and difficulty concentrating happen. This neurological recovery is essential for the brain to return to its normal state. Emotionally, the person might feel embarrassed, anxious, or upset after waking up. Providing reassurance and a calm environment helps them feel safe and supports their recovery. It's important to stay with them until they are fully alert, oriented, and able to respond normally. If the seizure lasts longer than 5 minutes, or if multiple seizures happen without full recovery in between, emergency medical help should be sought immediately. Medical professionals will want to evaluate for injuries and review the person's seizure management plan to prevent future episodes. Supporting recovery involves simple but important steps. Make sure the person is in a safe, comfortable position, preferably the recovery position, to protect the airway. Do not give food, drink, or medication until they are fully awake and able to swallow safely. Keep a close on their breathing and responsiveness. Offer reassurance and a quiet environment as they regain full consciousness. Remember, each person's recovery can vary, and some may need more time or medical attention. The postictal phase is a vital time for the brain and body to reset after a tonic-clonic seizure. Proper first aid and follow-up care are essential to ensure safety and ongoing health. Always consult healthcare professionals for personalized advice and management plans tailored to individual needs.